put a little bit down because of the fizzing and the change in the pH. It actually kind of corroded a little bit. Those are simple ones. And they say digestive enzymes, but you have to get a doctor's order for that, so it's kind of hard. The other one's cranberry juice. It tends to help dissolve. If you're giving meds through the NG tube, the key is to make sure that you have crushed them very thoroughly, and then you've diluted them well prior to giving, because those little particles of a crushed pill can clog your tube. All right. Patients that have NG tubes, you should also make sure, we talked about this in the last chapter, that oral care, just because they have an NG tube does not mean that you don't, that they shouldn't have oral care every 12 hours, even if they're not eating orally, because you're still going to get plaque and caries. All right. So then we're going to go to parenteral nutrition, which is a method of providing calories not through the gastrointestinal tract, which provides them directly into the vascular system. There are different ways of providing it. It's either total parenteral nutrition or peripheral parenteral nutrition. TPN is safer and it's better tolerated. Actually, parenteral nutrition is preferred because it's more cost effective, it's better tolerated, and you continue to use the GI tract if you're giving it enterally or parenterally, in other words, in the gut, which is always healthier for the patient. The biggest concerns is the thickness and osmolarity of the feeds. If you have a very hyperosmolar feed that you're giving your client, a very thick solution that's hyperosmolar, it's going to pull water with it, so it's pulling the water out of the vascular system, and you can actually cause dehydration in your patient. So it has to be very carefully given over a set amount of hours. If you're just beginning parenteral nutrition, GI feeds with your patient, you begin in small amounts and you increment them slowly over time as the patient is tolerating it both physically and chemically. So you do blood sugar tests to make sure you're not making them hyperglycemic. Okay. Some of the symptoms of hyperosmolar intolerance would be nausea, vomiting, dehydration, hypotension, and tachycardia. So your patient's going to be responding in a negative manner. Those symptoms are called dumping. It means that they're actually they're going to have serious diarrhea, and it's just going to be coming out the other end almost as fast as you're putting it in. So that's a very big symptom that they're not tolerating the hyperosmolar solution. The formulas that are fed are varied. There's lots on the market. They have all different kinds of names, and the different formulations just have different vitamin and electrical contents. They'll also have different calories in them and different distribution of the calorie, the proteins versus the fats versus the carbohydrates. And depending on the reason for giving the parenteral